Anxiety medications can be confusing because some are meant to work slowly, some are meant to work fast, and some can become risky if you use them the wrong way. So in this video, I'll explain the main types of anxiety medications in plain English, what they do, why doctors prescribe them, the trade-offs, and why medication is often a bridge, not the whole situation. Let's start with the most prescribed group of anxiety medication. Number 1, SSRIs, selective serotonin reuptake inhibitors, drugs like Zoloft, Lexapro, and Prozac. Your brain has a chemical called serotonin that helps you feel calm and steady. Normally, after your brain releases serotonin, it gets vacuumed back almost immediately. SSRIs block that vacuum, so serotonin lingers, floats around longer, and over a few weeks, this helps quiet the worry circuits. Think of it like a dimmer switch on your anxiety. The lights don't go off, they just get turned down. But here's where it gets interesting. SSRIs don't kick in right away. In the first 2 weeks, you might actually feel worse, more anxious, more on edge. Some people quit before the medication even has a chance to do its job. And then there's something doctors rarely warn you about: emotional blunting. According to a large New Zealand survey, up to 60% of long-term SSRI users report it. You don't feel deeply sad anymore, but you don't feel deeply happy either. Sex feels muted. Music doesn't move you the way it used to. You're calmer, but something is missing. And then there's the side effects doctors often downplay: weight gain. Studies show that SSRIs can cause people to gain a little weight over time. When people first start taking them, some might actually lose a tiny bit of weight, but after several months, most people slowly gain some. Paxil, paroxetine, tends to cause the most weight gain, while others like Prozac, fluoxetine, and Zoloft sertraline don't cause as much. The differences between most SSRIs are pretty small though. A different type of antidepressant called Wellbutrin, bupropion, causes the least weight gain of all. Number 2, SNRIs. Now here's where it gets weirder. This second group of medications takes everything SSRIs do and adds another layer on top: serotonin and norepinephrine reuptake inhibitors, SNRIs, include drugs like Effexor and Cymbalta. These don't just keep serotonin around longer, they also boost norepinephrine, which is your brain's energy and focus chemical. So instead of just feeling calmer, it can also help you feel sharper, more alert. For some people, this combination is a game changer. The anxiety drops, the energy returns, and life gets workable again. But here's what nobody tells you. SNRIs are notoriously difficult to come off of. Effexor is famous for what users call brain zaps, tiny electric shock sensations in your head when you miss a dose. A 2019 study published in the Addictive Behaviors Journal reported an average antidepressant withdrawal incidence of 56%. The medication works, but your brain quietly becomes dependent on the steady supply. We'll talk about dependence more when we get to the benzodiazepines like Xanax and Klonopin. Let's move on to number 3, Buspirone. This is one medication almost nobody talks about. The brand name of Buspirone is Buspar. It works on serotonin by gently activating one specific calm-down switch in the brain, kind of like adjusting just one knob on a big control panel instead of turning up all the knobs at once, the way some other anxiety medicines do. It doesn't sedate you, it doesn't get you high, it doesn't cause dependence, it just gently turns down the volume on chronic worry over a few weeks. The catch? It only works for some people. But for the ones it does work for, it's one of the cleanest anxiety medications available. No emotional blunting, no withdrawal, no sexual side effects, no weight gain. Number 4, Hydroxyzine. The brand name is Withdrawal. Technically an antihistamine, same family as Benadryl, but at certain doses it has real calming effect on the nervous system. It works fast, within 30 minutes, no dependence, no withdrawal. Doctors often prescribe it as the non-addictive alternative for anxious nights when your brain just won't shut off. The trade-off? It can make you drowsy, really drowsy. So it's mostly used short-term or as a sleep aid when anxiety is keeping you awake at 2 a.m. Number 5, Gabapentin and Pregabalin, brand name Lyrica. Now, this group is interesting because they were never designed for anxiety at all. These were originally seizure medications. Then doctors discovered they help with nerve pain. Then they noticed they also calm anxiety. They work by quieting overactive nerve signaling in the brain. For people with severe anxiety, especially anxiety tied to chronic pain or alcohol withdrawal, they can be a game changer. But gabapentin and pregabalin have a dependence risk that's only recently been acknowledged. A 2020 study published in Drug Safety showed that people with a history of psychiatric disorders or substance use disorder are the highest risk, and that pregabalin misuse is more frequent than gabapentin misuse. Number 6. Beta blockers. Here's where it gets fascinating. Some of the most effective anxiety medications were never designed for anxiety at all. Beta blockers, like propranolol, were originally made for high blood pressure. Then doctors noticed something strange. Patients on beta blockers stopped having physical panic symptoms. Here's why. When you get anxious, your body releases adrenaline, your heart pounds, your heart trembles, your voice shakes. Beta blockers block adrenaline, the body's primary fight or flight chemical, from reaching your heart and blood vessels. This helps your body relax. Think of it like unplugging the body from the brain's alarm system. But beta blockers like propranolol also reduce the emotional intensity of stress and anxiety, not just the physical symptoms. This is why public speakers and musicians take them before performances. They calm the brain and help to break the loop where physical panic feeds mental panic. They work fast and can be taken 30 to 60 minutes before a performance or anxiety-provoking event. Number 7. Benzodiazepines, the most powerful anxiety medications ever created, and the most dangerous. Examples are Xanax, Ativan, Clonopin, and Valium. The rescue drugs, the ones people take when a panic attack is actually happening. Here's how they work. Your brain has a chemical called GABA, which is basically the brake pedal of your nervous system. When GABA fires, your body slows down. Benzos slam that brake pedal to the floor. Within 20 minutes, you can feel the effects. Picture this. You're driving on the highway and suddenly develop a panic attack. You immediately pull over. Your hands are shaking. Your heart is pounding so hard you can hear it. You feel like you're having a heart attack. You take a Xanax. 15 minutes later, you feel the panic easing off. You begin to feel more like yourself again. And in that moment, the pill feels like a lifesaver. But here's the part nobody warned you about. Your brain adapts. After a few weeks of regular use, the brain's GABA receptors undergo down-regulation. This makes the system less responsive to GABA. Stop taking it suddenly, and your nervous system goes into a shock-like state. Rebound anxiety worse than what you started with. Difficulty sleeping, irritability, in severe cases, seizures. According to a 2017 study published in the New England Journal of Medicine, benzodiazepines are relatively safe for short-term use, 2 to 4 weeks. Long-term use is not recommended. Also, dependence develops in about half of patients who use benzodiazepines for longer than 4 weeks. Just 4 weeks. This is the part most people don't often talk about. Most of these medications work. They genuinely save lives. Millions of people are functional today because of them, but they were never meant to be the whole answer. They were meant to be a bridge, something that holds you steady while you address what's actually underneath. And what's underneath is almost never just brain chemistry. It's a nervous system stuck in fight or flight for years, sleep that's been broken night after night, hormones shifting in midlife, inflammation quietly burning in the background, chronic stress that never gets addressed. No pill fixes those things. The pill stabilizes the symptoms while the root cause keeps burning underneath. So if you're someone who's been on medication for years and still doesn't feel like yourself, you're not broken, you're not weak, you're not failing. You're someone whose nervous system has been carrying too much for too long with too little support. The medication did its job. It kept you functional, but you need to address the root causes, and that's exactly what this next video talks about.